Welcome to Prologues. My name is Mary, and when I get overwhelmed and start feeling behind, I find it helpful to zoom out and remind myself that I am still in the beginning of my story. I'm sharing all of my life's chapters: mental health, relationships, wellness, beauty, the chaos of being in my 20s, and all of life's unexpected turns. Prologues is the best way to start your week, so join me every Monday morning for a new entry into my digital journal. Hi, everyone. Welcome back to the Prologues podcast. Today, we have a very exciting guest. It's the first time a therapist has ever been on the podcast, and we're welcoming Dr. Shelby Reep. She's a licensed psychologist with a doctorate in clinical psychology, and she works as a relational psychodynamic therapist, which she is going to explain in the episode. She specializes in religious trauma and relational trauma, perfectionism, burnout, anxiety, identity exploration, all the things. And I'm very excited to have her on the podcast today to discuss topics like religious trauma, what it is, what it looks like, and therapy practices in general. She's answering a lot of questions about therapy for anyone who maybe doesn't feel comfortable asking the questions to their own therapist or who's interested in trying therapy for the first time. We share a lot of vulnerable things. I definitely got vulnerable in this episode, but I'm very excited to share this with you guys. I've been in and out of therapy for the last 10 years, and I learned a lot of things today through this recording. I loved having Dr. Reep on. I think you're going to enjoy this episode. So thank you so much for coming on the podcast. I'm really excited to chat with you about all things religious trauma, relational trauma, mental health in general. You're the first therapist I've had on the podcast, but I'm excited. I know so much of my community resonates with these mental health struggles and experiences, and we have lots of questions for you.
Yeah, I'm excited. Thanks for having me. Like you said, my name is Dr. Shelby Reep. I'm a licensed clinical psychologist in the state of Oregon. I practice in Portland. I'm also a relational psychodynamic therapist. That's my approach. I mostly work in person, but also provide telehealth services. And my specialties are religious trauma, relational trauma, anxiety in kind of its trifecta of perfectionism, identity, and burnout. And then my research has been on women's body image. So I do a lot of work around that.
Just before we get into today's episode, where can we find you?
Yeah, so on Instagram, my handle is at dr.shelbyreep. I have a professional website, presentmindcounseling.com. And then if you are searching for a therapist in Oregon, you can always use Psychology Today, which is a directory. And my profile would be on there just under Dr. Shelby Reep.
Okay, perfect. And I'll link all of this in the show notes as well. So you said psychodynamic.
Mm-hmm.
And what does that specifically mean?
Yeah, so when you're in graduate school studying to be a clinician, there's a few different starting points. So you could be getting your LPC, which is a professional counselor, an MFT, which is a marriage and family therapist, or you could go the route of a clinical psychologist, which is what I am. That's a doctoral route. The other ones are master's routes. And the biggest difference is that a psychologist is considered a social scientist, and the others would kind of fall under the umbrella of a psychotherapist.
Okay.
A lot of those terms are pretty interwoven at this point. Therapist is an umbrella term in the same way that music and genres, it's kind of the similar space. As a psychologist, I went into grad school and I studied multiple modalities. So things that may sound familiar is like cognitive behavioral therapy. But I was trained in CBT as well as psychodynamic therapy, emotion-focused therapy, acceptance and commitment therapy, group therapy, couples therapy,
all the things,
all of the above. And that's kind of one of the benefits when you go the doctoral route, is you just have more time and training to learn multiple modalities. So if we kind of use that language of music and genres, it's like I learned a lot of different genres. Psychodynamic therapist is someone who does more depth-oriented, trauma-based, really rooted in attachment and unconscious processes. So,
love that.
Yeah, so I tend to sit with people for years sometimes. I meet with people frequently, and we're usually doing deeper work around family of origin at first, attachment at first, and then really weave in this kind of collaborative curiosity. So we start sessions when I say, where should we begin? Something kind of loose like that. And there's this opportunity for whatever is unconscious to kind of come up. There isn't a structure and there isn't a specific goal in mind for each session, apart from how authentic can we be in this here and now moment? What is showing up right now that is unique to what we create in this space? So that is a glimpse of kind of what psychodynamic work is. It's really rooted in relationships. So I see relationships as the theme or the golden thread to follow. If we were hurt in relationships, we can heal in relationships. And so I use the therapeutic relationship really openly. It's my biggest tool in the room. And that can be different from maybe more behavioral approaches like CBT, where my patients will ask questions about me pretty openly and will use what's coming up between us and about me in the room.
Interesting. Mm-hmm. I've done CBT before. Mm-hmm. I've shared this on the podcast before, but my history with therapy is that I was put into therapy by my parents when I was 15 or 16. And I've been in and out for the last decade. I've been with a trauma-informed therapist since early 2023. Mm-hmm. And it's been the best thing I possibly could have done. It's been one of the best choices I've made in my adult life. And I've done CBT in the past, but what you're describing sounds very similar to what I'm doing with my therapist currently. Yeah. You said you focus on family of origin at first. And I remember the first probably 4 sessions with this therapist, we only talked about my family.
Yeah.
And we only talked about like ages 11 or 12 and younger.
Yeah.
And I remember learning that so much of the way that we attach to others and the way we behave in relationships as adults was formed because of things we experienced ages 0 to 7 and even 0 to 3. Mm-hmm. And it's crazy for me to think, well, I'm 25 now. This was forever ago. How can my choices and my feelings still be influenced by something I witnessed when I was 2 or 5? But it's so real. And like the longer I've been in therapy and the more we've been able to unpack and the more I've allowed to come to the surface, mm-hmm. the more I realize, wow, no, it really all does go back to early childhood experiences.
Yeah. I think what you touched on, sometimes there's a quick frustration where people will say, why am I talking about my parents? Or a fear of like villainizing other people and wanting to protect mm-hmm. family. So I'm pretty...
I do not have that fear in therapy.
Yeah, sometimes it swings the other direction. I think that's why I tend to follow a relational approach, because each relationship is going to look really different. Mm-hmm. I may have someone come in who's ready and accessible to start talking about 7 and under right away. Our first few sessions kind of look idyllic in that sense. And then it may be 3 years before someone tells me mm-hmm. about their family or where they fall in their family structure. So
it takes practice to speak to a therapist. Almost from a client perspective, it takes a lot of practice to be able to access that deeper part of your mind and your memories. Mm-hmm. And I've been doing it for long enough that it comes naturally to me now. But when I was younger, as a mid to late teens, it was very hard to feel comfortable enough to even get to that point.
Yeah, absolutely. And that's why, for depending on where you're meeting someone at their stage of life, therapy, as a therapist, there's kind of a unknown quality of the work you're doing. You may be the one just kind of planting the seed, and then 5 years later, they may see a different therapist who names something similar and they go, yes, that's exactly what's happening for me. Mm-hmm. So it really can depend on what stage of life you're in when you're entering therapy, how it's going to show up for you. And that's why I think it's important to have a relational approach, because if I just had a manual and I said everyone who feels anxious should show up like this and we should do this work and it should be done in 12 sessions, then we forego anything that's unique about you. But if we can sit there and say, well, maybe I'm just going to be the one who builds comfort for you with opening up to someone new. Maybe that's what this round of therapy will be. It allows for this flexibility. Yeah.
Yeah. Even now, with my therapist, who I've been with for over a year. I feel very comfortable with her. And like I said before, I don't worry about protecting people when I'm in a therapy session. I will name drop every single person. I give the juiciest details, and I'll do it about myself too. Like, I've never not told a therapist something because I'm worried it'll make me look bad.
Yeah.
I truly get in my therapy sessions and am just unhinged
Yeah.
because that's what helps me the most. So even now, I'll get into a therapy session, and some weeks we'll start the session and I am immediately ready to go. I've got like a list of things. I'm crying immediately. And then maybe the next week we just end up gossiping for the whole hour.
Yeah.
And even though we're not talking about anything like really personal to me, it still feels productive in a way.
Yeah.
Because it's still like that safe space with a third party person. Sometimes I will just get in there and like just spill tea.
Yeah.
And then sometimes I'll get in there and I'm sobbing from second one.
Yeah. Depending on the therapist's approach, they would say that everything coming into the room is of value. So when I'm sitting with someone and they, begin by talking about their pets, and we spend 20 minutes talking about their pets, I'm not necessarily looking for what is the most, quote unquote, productive way to use our time. My question usually is, I wonder what's going on that makes this feel like the most important thing in this moment, or what makes this feel the safest to talk about right now. And it may give me a clue into what's going on in their life. They may be wanting to share something about themselves with me. They may be wanting to keep me at arm's length, so there's so many different things that I think anything that's showing up in the room is valuable, and it's for you both to kind of parse through. Mm-hmm.
This is so interesting for me because I've worked with therapists so often, but I've only ever spoken to a therapist from the client, like the patient perspective.
Oh.
I've never spoken to a therapist before and heard what goes on the other side of the room. So this is very interesting for me.
You see back here, it's funny because most of my friends, 3 of my best friends are also psychologists. And so there's kind of this shared... There's no filters in that sense from our conversations. And so, then my friends who aren't therapists are so used to hearing therapists talk that sometimes I forget that that's not as normal. It's such a huge part of my world. So that's funny.
I like that. Well, so I asked my Instagram, what do you want to ask a therapist? A lot of people who are in therapy had questions that they're a little bit too nervous to ask their own therapists. And then some people haven't started therapy but are curious about it. So we've got a lot of questions to go through, and we can just let them guide the conversation. You've answered this a little bit already, but one thing I wanted to ask you was, what do therapists actually do? Because there seems to be a huge amount of confusion surrounding what they do and what the purpose of therapy is. I got so many responses from my Instagram, and it was interesting to see how some people have polar opposite views of what therapy is and what its purpose is. So people would say, how do I ask my therapist for a more solution-oriented approach? I feel like all we do is talk. And then some people said, my therapist tells me what to do and I don't want that. I just want to talk.
Yeah.
Some people feel like therapy is not for them because they're too self-aware for it. So they think it must not help me at all. And a lot of people want to know, can therapists diagnose you? So many questions about what is the purpose and what is your role in the patient relationship.
Yeah, the whole machine.
Yeah.
Okay, well, let's kind of dive in. So, I named earlier, there's kind of these different genres and there's different titles. So I'll kind of start from the mechanisms of that. It's going to depend on who you're sitting with, what that therapist, what their title is, what they are trained in, and what they specialize in. There's kind of this air in social media that kind of everyone should go to therapy, and therapy is like this drop-in, it will immediately click and connect.
Yes, I've seen that.
Yeah.
I disagree with that.
I do too. Therapy is a relationship. So the same, like if you said, I want a partner, and then you just scan a room and you pick a person, you go, partner, right? Well, they're a person, and that's it. It's so dehumanizing to just kind of look around and say, oh, I need a friend. There's a person that will be my friend. And it's kind of similar with therapy. I really encourage people to therapy shop, meet a few therapists, see who you connect with. You may feel you want someone older, and then you sit with someone older than you and realize, oh, that doesn't feel good to me. You may want someone who is solutions oriented, and then you sit in a solutions oriented session and you go, oh, that doesn't fit for me. So I think there's room for remembering that therapy is a relationship at its core. It's another person, it's not a machine. They will have their own understandings of what healing is, of what therapy looks like. And it is your right as a patient to shop around and then find a fit.
Yeah, you have to be compatible with the person because you're about to share some of the most intimate and vulnerable details of your life.
Yeah.
And if you don't feel comfortable to even speak about those things, and also even if you don't, even if it's not a comfort issue, you're just not compatible with some people.
Yeah. Yeah.
Yeah.
And they can be incredibly kind and compassionate, and you just do not click in the same way that you may date someone who you think is wonderful and go, but they're just not wonderful for me. So that, I think, is a huge part of one, finding a therapist that you actually feel you could eventually build trust with in time. It will not happen in the first few sessions, but finding someone that you are willing to speak openly with or feel you could eventually build trust with. I think it's a good thing if you walk in and you feel like you like them, something about them, you're like, oh, I kind of like what they're all about or their vibe.
Yeah. And that's easier to pinpoint the more you go through it as well. I feel like a lot of people try therapy once and don't like their therapist and assume therapy itself is not for me.
Right.
And really, they weren't compatible with that person.
Right. And that's kind of the robot, right? Like anything could sit in front of me and it should do what I want it to do.
Yeah.
Versus this kind of more human space. So that's one thing. I think finding a fit. The other piece that I would reference, of this kind of dichotomy of I just want to talk or I want advice, I want solutions, that will come down to their approach. So I really encourage people read your therapist's bio. They write it for a reason.
Yeah.
And they should offer what they specialize in, what they do, what their approach is. If there is a word that does not sound familiar, Google it and see, does that align with what you're wanting? That is what I would say you can do as a patient. And then listen for when you sit with that therapist in that first session, do they offer you pretty explicitly, this is what I do? When I meet someone for the first time, I explain, I'm a relational psychodynamic therapist. This is what that means. This is kind of what a session will look like. If someone calls me and says, I want skills, I will say, I will refer you. That is not the work that I do. I will never withhold a skill set if I think there's something I can offer. If someone's sitting with me and they're having trouble building habits, I'm not going to withhold, a helpful tool, but it's not the majority of the work I do. So that would be a big piece, is asking your therapist, what is your approach? I think it's a great question to ask a therapist. What do you think healing looks like?
That's a great question.
Because that will give you insight into their philosophy and what's going to kind of guide their end of treatment. Hopefully it's collaborative of what you both bring to the table. But again, if someone called me and said, I want someone who's going to give me solutions, I would say, that's not me.
Right.
And there's a lot of philosophy behind that. Each therapist kind of has their own, hopefully, whole base for why they do what they do. I think it's a great question to ask when you call a therapist, even before you set up a session, to ask, what is your approach or modality? And, what do you think offers healing?
Yeah, it's so interesting you mentioned that because I had that conversation with my therapist literally yesterday in my session. We talked about what I think healing looks like and what she thinks healing looks like. And we agreed that we think my answer will evolve over time as we keep working together. But yesterday I said, I was referencing different traumatic points in my life that we focus on a lot. And what I said, what healing means to me right now is that when I think about these things or I remember these moments, I don't have a visceral emotional response. And I want to be able to observe the memories from a more casual, bystander perspective rather than feel I'm right back in it again. So for me right now, healing looks like working through things to the point where my emotional reaction is calmer.
Yeah.
And then who knows, maybe that will look different later on. But I remember my consultation call with this therapist, which was over a year ago now. We talked about what my goal was and why I was coming back to therapy in the first place. And it's interesting that so many people talk about feeling like they're too self-aware for therapy,
Mhm.
because I remember talking to my therapist for the first time and I said, I have not been in therapy for a few years. And I feel that I have intellectualized all of my problems to the point where I'm not processing anything.
Yeah.
I've intellectualized them to the point where I feel like I must be over things by now, but I've realized that I'm actually not processing anything. So I'm coming to therapy because I am self-aware of why I'm feeling the things I'm feeling. I can identify the triggers and the trauma points and all those things, but that doesn't mean that I'm working through them. That doesn't mean that it's getting better at all.
Yeah, I think you hit something so powerful. And, I would hold compassion. If someone comes in and tells me that they're really self-aware and so they don't know if therapy will fit, I would be really curious what that means for that person.
Yeah. That's what my therapist said.
When I hear that, the first thing that comes up for me is a little bit of what you're naming, intellectualizing, but also there's a self-critical and a protective component to that. So essentially, well, I already know everything about me, so there's nothing new you could show me about myself that I don't already know.
Interesting.
That is self-criticism. That is
Is it?
self-objectification, and self-flagellation is a term I use a lot with patients.
Self-flagellation. I love that.
And again, really depending on who I'm sitting with, I may be sitting with someone, like yourself. You've been in therapy for years. You do have insight into a lot of what is coming up for you. It's not to immediately shame. No one is self-aware. Everyone needs to be in therapy. That's not the tone. But I would be really curious what self-awareness means for that person. And is your version of self-awareness offering you ease?
Mm-hmm.
Is it offering you peace?
Yeah. And it doesn't. At least in my case, it didn't.
Right.
I described myself as self-aware in that call because in the years that I wasn't in therapy, after I realized I had religious trauma, which is a whole other thing, it took me years to even realize I had that.
Yeah.
I learned everything about it that I could from an academic standpoint. And I approached my deconstruction from a very cold, intellectual standpoint.
Yeah.
When I was diagnosed with bipolar and with OCD, something that gave me comfort was learning everything scientific and factual about it that I could.
Yeah.
And so I did that for years. And it helped at first because understanding why something happens or what the common symptoms of something are, like that gives you a little bit of comfort because you realize, okay, it's not just me. This is typical for the diagnosis I've been given and things like that. But then it got to a point where I was aware of all of that, but that doesn't mean I was fixing anything. I wasn't processing anything at all. So for me, being self-aware meant understanding from an academic standpoint, but that wasn't serving me. Like you said, it wasn't bringing me peace at all. I have some friends who are in therapy and have been in and out of therapy again for years who got diagnosed when they were really young teenagers and things. So we're all familiar with the process of therapy and you know all the terms, and if you're not with the right therapist, maybe you can predict what they're going to say to you. And I think that can lead to a lot of these feelings of discouragement that it seems like people are feeling, where they're like, therapy's not going to work for me. I already know this.
Yeah. And that maybe brings my mind went to so many different places because I think you're naming something really important. Therapy is meant to be a place where you are challenged. If you do not feel challenged by your therapist, my first instinct would be to say, if you like your therapist and you feel connected to them, tell them.
Okay.
I think there's kind of this fear dynamic, and it really depends on the dynamics that you and your therapist have. So I'm going to speak from what I think should be happening, and we can kind of take a grain of salt there. The hope would be you feel connected to your therapist. If something feels amiss, like they really missed you on something or they're not hitting something, you're leaving feeling frustrated, I would hope that there is enough rapport where you can go in and say, I really didn't like when you said this. I wish you would challenge me more. I need more from you in this way.
Okay.
And be able to have this dialogue with your therapist around what feels is missing. Is that something your therapist can provide? And if not, what would it look like to transfer care? What I see happen a lot is, for whatever reason, someone feels like it's no longer fit, and then they ghost their therapist.
I've done that before, I'll be honest.
Yeah.
I was young.
Yeah. I think a lot of people do, and it's not to shame that, but what I think is missing is the opportunity for repair.
Interesting.
It's very rare where we get to come back to a relationship and say, I feel like you didn't get me here, and I wish you would have. And if that person can, for them to then be able to reach back to you and say, okay, you're right, I missed you here. And if they can't, then be able to say, how can I still support you in moving on? That is the role of the therapist. It doesn't offend me when someone doesn't want to work with me anymore. I may have my own, reactions that I will deal with because they're mine. But it doesn't offend me if I'm not a fit for everyone because it's a relationship, right? So I'm not going to be the best fit for everybody. My role, my professional role then, is to help you find someone who is a good fit. And there's something really great about being able to have a last session where we recognize what wasn't there that you needed, what do you need now, and how can I help you find that? Your therapist is a resource. And I think the more direct conversations you can have about what you need and what you want and what you expect, the more powerful the work can be. And I would maybe put this out there if there's any therapists listening, that's definitely on you too. The therapist should be asking, do you feel like this is a fit? How are you feeling about our work? Did I miss you there? I'm constantly asking my patients,
do you feel like you're seeing improvement?
Yeah. Or even, how did you feel last session? I left feeling a little weird about this interaction. How did you feel? It's our responsibility to catch and to hopefully offer a safe space to dive into hard conversations.
I guess that's surprising to hear from me because I've never had that conversation with a therapist. I'll be honest, I did ghost a therapist because I didn't feel like it was a fit for me anymore. I was young. I wouldn't do that now. But I didn't even think about the fact that therapists would be wondering from your end, is the patient feeling like this is productive for them? Is the patient seeing improvement?
Yeah.
Interesting. Well, so along the notes of what we just talked about, a lot of people wanted tips on two things that are related. So one is, we always hear that you have to process your emotions and you can't intellectualize, you need to process. And then also, what are the tips for not intellectualizing? So what does processing your emotions look like in practice? And what are the tips that you have for not intellectualizing and moving into processing?
Yeah, that's a great question. What comes to mind for me is there's a term in DBT, dialectical behavioral therapy, which was actually originally developed for borderline personality disorder, because one of the tricky parts of that personality, that lifestyle, is that you tend to see things in very black and white terms, and it can make it really hard to process emotions or to allow experiences without attaching really strong meaning to them. So I would say distress tolerance is a huge part of processing your emotions. That being, what does it look like to notice and allow a feeling to show up without doing anything about it, without making it mean something, without putting a judgment towards it. The image I give patients a lot is kind of like a big wave crashing. So you may feel a huge swell of an emotion, like grief. Grief can be really consuming. What would it look like to allow it instead of trying to avoid it and dodge it and push it away and make it mean something? All of that can come later. Yeah, processing is, can you sit and feel grief and not do anything about it?
In the discomfort and allow yourself to feel it.
Yeah. And I think that comes with some compassion for yourself, being able to sit and actually say, feeling depressed or feeling despair, feeling dread, feeling worry, that's an acceptable thing to feel. So you kind of have to do some work around shame,
Right, because those feelings, they're amoral.
Yes, yeah. Yeah, morality and meaning get attached to emotions so quickly. Maybe this is kind of that intro point there. If you've come from a religious background, especially, right? Anxiety is a big no. That takes some unlearning. So I want to like really validate and show some compassion to people saying, what the heck does processing your emotions mean?
Yeah.
Because I think it's multifaceted.
And it's uncomfortable, and it's meant to be.
Yes. I think the takeaway would be allowance. If you can associate processing emotions with allowance, permission, and then to acknowledge if shame or judgment or meaning making shows up for you, that's a huge part of being able to learn how to sit with them.
I feel like I process my emotions the most clearly when I'm journaling, because it allows me, like the physical act of writing allows me to tap into a more contemplative state, I think. And when I journal, because I don't know how to describe this, because it takes much longer to physically write something out than it does to think it. It forces me to sit in the moment for a lot longer.
Yes.
And because I have to actually find the words to communicate on the page what I'm feeling, I have to acknowledge it on a deeper level in my own system. So journaling, for anyone out there who might be looking for an actionable tip, journaling helps me process so much. And it's interesting you bring up shame. So I've spoken about having pretty severe religious trauma off and on. I used to share about it a lot more. If you've been following me since I started social media in like 2020, I used to be really open about it because that was around the time point where I was realizing that I had it in the first place. I left the church in 2016 when I moved out of my hometown, and it took me until 2020, 2021 to even realize how traumatizing it had been. So I talked about it a lot more then, and then I kind of stopped over the years. One, because my audience got bigger and I got more scared to talk to a larger group of people about something more vulnerable. And then two, because it just started getting harder. Because after I realized I had the trauma, then I kind of moved into processing the trauma, and it became something that was really difficult to speak about. So I talk about the fact that I have it, but I haven't gone into detail in a really long time. I keep saying like at one point I'm going to make a podcast episode where I talk about it in depth, and I just know I'm not there yet. But one thing I will say is that when it comes to mental health, growing up as a really mentally ill kid, I started displaying symptoms when I was around 12. I grew up in a very toxic, high control, evangelical Pentecostal environment in a very large church in the rural South. So you can, that says enough. Purity culture, purity classes, purity pledges, subservience of women, a lot of deeply ingrained misogyny and homophobia and xenophobia, and a lot of Christian nationalism and all the things. And one of the things that I was taught over and over again growing up is that health and healing is a gift from the Lord. That's a reward for your faith. So if you have a problem of any kind, whether it's mental or physical, and you pray and you ask God to heal you from it, if you're a good enough Christian, he will. And if your faith is lacking, or you have sin in your life that you're not fixing or repenting for, then you will continue to have the health issue. So I didn't even know I had mental health problems back then. I couldn't have verbalized that. But I knew I didn't feel right. I knew I was different than the other kids. And I would, God, it sounds like sad when I say it. I'm fine from this, you guys. Like, I've worked through this. But I used to like lay face down on my bedroom floor as a teenager, sobbing so hard, like begging God to take it away and to make it stop. I felt like there were tornadoes in my head all the time. I felt so, for lack of a better word, I felt so crazy and so deeply sad and deeply lonely. I'm tearing up.
Yeah.
I promise it's fine.
Simply, you know, if I
I felt so turbulent.
Yeah.
Because I was bipolar and I had no idea. So I was like rapid cycling through manic and depressive episodes. But I would like in church, Pentecostals are very vocal in church sessions. There's like speaking in tongues and they have like revival meetings. So there's like sometimes in Pentecostal sermons and things, there's like yelling and screaming and like singing really loudly. And I would just like sob in church and then in the middle of the night in my childhood bedroom, like laying on the floor, just thinking I must be the worst person in the world because why am I like, surely God can see and hear me so distraught, like begging him week after week after week for years of my life, like begging him to take it away. And that's not how mental health works. So it wasn't being taken away. And I really internalized this feeling of like, well, I must be the worst person in the world. I was already dealing with the feeling that a lot of people on Instagram mentioned as well, like dealing with self-esteem issues that comes from being told you're born a sinner and you are born deserving eternal conscious torment.
Yeah.
So I'm already going through that. And then I was going through feeling like God must think I deserve to be as messed up mentally as I am.
Yeah.
The shame is something that I talk about in therapy all the time. I said that whole long story to say the shame piece and the self-judgment piece is so critical to unpack because I feel like you're never going to get anywhere until you can accept the fact that you're having these experiences and you can observe them from a place of not judging yourself. And you don't judge yourself for maybe the things that you've done from an unhealed place. Like you have the responsibility to work on it. But you also have to hold grace for yourself for the things that you did that came from like an unhealed place.
Yeah.
And that's really hard.
Really hard.
It's easy to recognize. And again, that's easy to intellectualize for me. And it's really hard to do.
Yeah. I really appreciate your willingness to share that. And, you know, one thing, even just as you were talking, I deeply resonate, you know, some of my own experiences. I had really severe anxiety when I was younger, and I would collapse, which now we would know as a panic attack. And in the church, there was a lot of weaponizing of that. And at one point, it was actually safer for people around me to wonder if I was diabetic. So they would give me orange juice when I was collapsing. Maybe that's a funny anecdote, but I think there's a sense of there was so much denial around their of mental health that it was actually safer to say there's something medical than to acknowledge that anxiety could be anxiety, depression, suicidal ideation, dread, that all of these things could show up in a religious framework.
It's interesting because I was most definitely not the only person in my church who had mental health issues. Like people committed suicide. People would be up at the altar every single week. They do an altar call for people who needed healing, and people would go up every single week for depression and anxiety, and every single week get told, you just need to have more faith. You just need to pray.
Yeah.
There's already like such a stigma that people with mental health issues face in the regular world, in the not religious sphere. And then you add that religious programming into it, and it's a recipe for trauma. It's a recipe for wounds.
Yeah. Yeah, there's so much in there. You know, a few things that stood out to me was shame. Well, you actually, I think, really beautifully put one of the kind of core concepts of what brought religious trauma up to the surface, even as a topic. So that's what I specialize in. It's a big part of the work I do. And the term like religious trauma syndrome showed up in the 90s in response. Marlene Winnell is a psychologist who coined that term. And she really explicitly talked about, you know, leaving evangelical spaces because there is this ultimate double bind of the doctrine of original sin and eternal damnation. You are guilty and responsible and face eternal punishment, and yet you have no ability to do anything about it.
Yes.
So you must conform to believing in an external, unseen source of salvation and maintain the state of belief throughout your life. You can't stop sinning altogether, so you continue to need God and religion and spaces in order to make it to heaven.
Yeah.
And yet you had no say in that process, right? You were born in a deficit you're born at a deficit, and now you constantly owe somebody without any choice that you made.
You were born so unworthy.
Yes. Yeah. And we, maybe not we, at a time in our lives would sing songs declaring our unworthiness.
Yes.
You talk about worship spaces. There's, I think his first name is Michael, but don't quote me on that. But the Gungor band who sang that, You Make Beautiful Things is a really popular song.
Oh my God.
Early 2000s.
You make beautiful things out of us. Yes.
Yeah. So they are
familiar.
Openly not Christian anymore, ex-evangelicals. I don't know what they would identify as now, but they talk a lot about the manipulation of worship music and how essentially it's a concert and you're feeling a lot of things because music is built for that. And so
I love this topic.
Yeah, you're confessing and crying and raising your hands and one, I will maybe put a buffer here. Like you said, it's a scary thing to talk about because a lot of people find identity in religion.
Yes.
And
which is fine.
Yes. And
it's fine. Like, I do want to have a caveat. Mm-hmm. I don't judge anyone who subscribes to any religion. I know what my experience was with the religion and with the specific church I was in. I have nothing but respect for people who choose to practice religion, especially those who know that they're doing it in, like with Christianity, in a way that operates first and foremost out of love, which is what it's meant to be.
Yeah.
I just want to say that this is not a judgment call upon anyone who subscribes to Christianity or any other religion, but yes.
So this may be a good kind of deciphering point of religious trauma and experiences within religion.
That's good. People asked, one of the questions I got was, does everyone who experiences religion have religious trauma? And I don't think that's the case.
There's so many predispositions for experiencing something traumatic. So what I would say is there is a lot of research out there that shows that religion can be a protective measure against suffering and mental illness and experiences of trauma. There is also research that shows it can be a harmful effect. So this comes down to an individual experience of how religion shows up in your life. And I would say, at least people who come to sit with me. So again, this is what I specialize in. So I get a lot of people reaching out wanting to talk about this. I am rarely talking about God.
I'm never talking about God.
Yes.
Me and God have no beef.
Yeah, I think that's a good distinguisher too, is that people are rarely talking to me about God. If we are, we're kind of talking about, again, existential beliefs that come from the Bible and phrases that are used that can be really anxiety provoking. 80% of the time, we're talking about people. We're talking about experiences in communities. And why that can be so harmful is because we're talking about power dynamics. And we have seen that in multiple religions throughout our history as humans, that power and manipulation are often used by calling on the highest authority. So if I say God is on my side, we really don't have a chip to play, right?
Yeah, which is why Christian nationalism is so prevalent.
Yeah, it can be a really, really hard thing to even engage in a conversation because, again, if someone thinks there's a lot of black and white thinking in religious spaces, and so if they think what I have to offer is the only right way, right? And that's a huge part of the Christian narrative, is this is the only way.
Which is fascinating because there's a zillion different denominations under the umbrella of Christianity, and they all think it's the one right way too. Like, I grew up Pentecostal, and Pentecostals most definitely believe that Baptists don't have it right. Methodists do not have it right. All these other denominations, and you grow up being told that you should feel lucky that you managed to find the denomination that is right.
Yeah.
And you are so lucky that you were born into a country or into a family or into a town or a community that actually knows the one true way. And you should feel so sorry for everybody else. And you should keep your distance because they're operating in, they're not speaking the Bible correctly. Like they don't have it quite right. It's insane. So crazy.
Yeah. They are of this world, and you are not meant to be
Of this world.
Yeah.
Oh my God.
Yeah.
I quickly wanted to go back to what you said about worship music, because I had such an interesting experience with this when I started deconstructing. Some of the most profound experiences I had when I was still in religion happened either at youth camps where they would have worship nights, or just at like during really prolonged worship sessions. And I obviously didn't realize until I left the church how manipulative those scenarios are designed to be, how they're designed to provoke intense emotional reactions that make you feel like you're intimately connected to the spirituality of the moment. And I remember going to a concert, like just a regular concert as an adult, and having a very similar, like profound emotional reaction during the concert and realizing, oh, I just like music.
Yeah.
It wasn't actually the worship music. I wasn't actually connecting to the spirit, or however your church described it.
Yeah.
I just enjoy music and was being affected by the music.
Yeah.
And so many of those feelings I learned later on were manufactured in order to keep me convinced that this all must be real.
Yeah.
Like if your emotions are telling you it's real, you can be convinced. And it's easy to manipulate emotions.
Yeah. I think you're naming an experience that might actually be helpful to kind of talk about the causes of religious trauma.
Okay. Yeah, definitely.
Yeah. So there's this damage to like emotional development, or even a suppression of typical child development, so your own formation of identity can start to get suppressed when there is one way to do things, one way to be, one way to interact, and there is one truth. A huge part of childhood development that we would say is typical, something you should encourage, is curiosity, of finding their own values, their own belief systems.
Yeah.
And if that is controlled and contorted, we are kind of taught to live in our minds and taught that controlling our thoughts is an answer versus actually its own source of suffering. And so then we have this like built up tension of emotions. There's nowhere actually for emotions to go. And then we're offered this huge release in a worship music setting. So there can be kind of this unconscious formula for how you are meant to kind of ride this wave of staying the course within a religious system. There are places you process, there are places you withhold, there are places you suppress. Everything is accounted for. It's very black and white. And that can be really tricky.
Yes. I'm just having so many memories come to the surface right now as we're talking. I feel like religious trauma is something that I expect will take me decades more, perhaps, at the very minimum years, to get to a point where I no longer feel triggered by the memories. And that's just how it is.
Yeah.
and it is what it is.
Yeah. Or maybe, a moment of compassion for both of us. There may always be a grief point of recognizing how much of our first exposure to identity was shame.
God.
And
Yeah.
that may be something that we wrestle with.
My therapist always reminds me I was raised in religion and I left when I was 18. So I was in religion for 18 years and I've been out of it for almost 8 years. And I wasn't deconstructing or processing for that whole time either. I didn't even realize, like I said, I didn't even really realize I had deep religious trauma until around 2020. I knew it was messed up. Even as a teenager, I knew something was not right, even before I left the church. And then when I did leave the church, but that's as deep as my thoughts went with it. I was like, that wasn't right. Like that was messed up. It wasn't until I was older that I realized, yes, that was messed up and I am deeply affected. So I've only really been working on this for 4 years.
Yeah.
So just from the time imbalance, like it's fine that I don't have it all worked through.
Yeah. I mean, a huge part of your life was indoctrination, into a belief system. And again, whether people choose to align with the values they were taught or choose to pull away, it's not necessarily to shame someone who stays in it, but there is the recognition of an indoctrinated belief system.
Yes.
If you are taught that there is one way to be and you choose to align with it or you choose to separate, still kind of acknowledging that process can be really hard.
Something that's also popped up a ton in my adult life is if you think about the relationship that you're encouraged to have with God and the church growing up, it is not a surprise at all to hear that I have an anxious attachment style.
Mm.
Because I was talking with my therapist last April and we were talking about attachment styles. And I was saying, in some ways I feel anxious, but in some ways I feel secure. And we were going through just those like little tests that you can take, those little evaluations. And she was like, yeah, it seems like you're kind of 50-50. Like you're secure in some ways and you're anxious in other ways. It took us 2 weeks to get to the root of that. But I came to the realization that, for context, my family operated in a way that I could not always reconcile with what was going on in the church. I have a good relationship with my family. I feel very blessed.
Yeah.
The relationship dynamics, the gender dynamics, all these different things that I saw modeled in my family were often opposite to what I was taught was right by the church, which was confusing for me.
Yeah.
So it took me 2 weeks of just talking about this, but I finally realized part of my attachment is secure because I learned security from my family, but part of it is anxious because my family was not the only group of people raising me.
Yeah.
The church raised me. I was in church at least twice a week, every single week of my life from the time I was born. So the church and my teachers in church and the things I learned there very much raised me as well.
Yes.
And there I learned anxious attachment.
Yeah, you are nailing it. There is a lot of studies have actually come out of God being an attachment figure as well as religious communities. And so what you do is you kind of branch out into there being a community that is raising you, and the impact of that, especially when you're young. If you think back to how old maybe some of your youth group leaders were,
Yeah, they were older than me.
Yeah.
Really older than me. My first ever relationship, I was 15 and it was with one of the youth leaders who was 19 turning 20.
Yeah.
And that age gap is problematic in its own way, although age gap relationships are heavily normalized within the church, especially when they're a young girl with an authority figure. Oh my God, I could talk for 6 hours about just how common age gap relationships are. And 15 to 19, almost 20 isn't as insane or as concerning as a lot of the ones I witnessed. It's still concerning. I still have issues from it, but it's not even nowhere near as concerning as like some of the other ones I witnessed. So yeah, youth leaders who you're meant to look to as these ultimate authority figures are barely older than you. They're barely adults.
Yeah. And it's usually this kind of wave, they're usually people that you grew up with in some way, who are now given a leadership. There's no new information coming in, rarely new experiences coming in. It's the same message, just from a different mouth, just over and over and over. And it's usually people who are really young. And if you think about that, this kind of impact of, you are not fully developed. You are very much in the plight of identity seeking in your early 20s. And to be told, this is the answer. I mean, how relieving to not have to sit in chaos when you are told this is the answer. Of course, young people are going to grab onto it because it's offering a rescue net from the chaos of struggle of finding your own identity, your own values, your own purpose.
And you're so actively discouraged to be questioning in any way.
Yeah.
My Sunday school or youth group leaders honestly did not like me very much because I was always accidentally being subversive because I was a questioning, curious child.
Yeah.
And in my family, that was okay. My parents are both well educated, and I was homeschooled, and they really prioritized our education. And so there was lots of hands-on learning, really active learning, huge emphasis on education, which is different from a lot of homeschooling experiences. I feel like I'm maybe one of the few homeschoolers who's also like religiously deconstructed, who thinks fondly upon their homeschooling experience. I think a lot of people have real issues with it, and I witnessed a lot of things that I have issues with, but in my family it worked. But we were taught to be curious because curiosity is one of the foundations of learning.
Yeah.
And so I would bring that energy into my classes, and I would try to call out like perhaps inconsistencies in the narrative in the Bible,
Yeah.
or logical inconsistencies, or things that as a kid just didn't make sense to me. And the only thing you're told is like, well, you need to lean not onto your own understanding,
Yeah.
or some things are not meant for our understanding, but don't worry, God is omnipotent and he has it all figured out. And our little human brains just can't even like begin to comprehend.
Yeah.
And so that any kind of questioning spirit is just squashed.
Yeah.
So tiny because they don't know the answers. That's the thing. Once you start asking questions, you'll ask questions that the leaders don't know the answers to. And so, rather than admit, well, I don't know, or you're right, that doesn't make sense, they have to say, lean on onto your own understanding.
Yeah. This may not fully map onto like age-wise, or maybe this will sound familiar, but there was a movement kind of in response to this in the church, apologetics.
Yes, I took apologetics classes.
Yeah. So there was this attempt to say, no, we really welcome doubt and questions, and then a doubling down on evangelizing in a way that sounded scientific. And so there's just so, I mean, I find myself just kind of sitting here feeling another tenderness for young me and young you and a lot of people, how tricky, what a feat to even begin to deconstruct when there's so much confusion and so much white knuckling of life. And I just feel like a real tenderness for even beginning to question, because it's all consuming, and it's really heavy because any question you do have, there is another angle where it can like loop you back in, and it can be really, I mean, sometimes better to drown than to fight, and that can be a really hard process.
Yes, it definitely silences and stifles you. And in a lot of ways, it's just easier to give up and just have blind acceptance than to risk social ostracization and judgment from being someone willing to ask. And I will say to anyone who's listening to this who is deconstructing or who doesn't know where to start, deconstruction is one of the absolute most difficult things I've ever done in my life. Emotionally difficult, cognitively difficult. It is no joke to try to unpack and heal from a lifetime of repeated trauma. And then also at the same time, deconstruct an entire worldview, your entire system of values, and try to figure out who you are, what your morals are, what your ethics are outside of all these things you've been taught. So if you're struggling with it, I don't have an answer for you at all, but I'll just say it's by far the most difficult thing I've ever done in my life. And the trauma bond to the church. This is a question that popped up a bunch of times on Instagram as well. People are confused about why they want to get away from it so bad, and at the same time, it's like they feel this pull towards it because there's this sick sense of comfort sometimes in the things that hurt you because it's what you know.
Yeah. Well, you named a few things just there, right? Is community, or most of the time your family, how you were introduced into the world, how you see how the world works, how it makes sense. So if you even begin to step out, you are now at risk of being
losing everyone.
Isolated.
Everyone.
Isolated, losing relationships, losing a pedagogy, something to build your life on, losing your morals, losing your ethics, losing how you view the world. I mean, there is so much at stake. So, yeah, I really don't hold any judgment or shame for people who would say, I kind of want to stay. And I think that's actually a big part of this middle group. So my kind of structure of people navigating religious trauma. There are folks who are in it and are just beginning to have conversations. There's like the budding awareness. There are people deconstructing. There are people who have accepted, left, and grieved. And then there is this pocket of people who are straddling the line. They may stay in their families. Sometimes they may stay in a marriage where now one person believes and one person doesn't.
Unequally yoked, which you're also told is
the terms, yeah.
Oh, all the terms, all the phrases.
Yeah, you may stay in a job, I mean, maybe a little piece of myself that is easily accessible is my graduate program was at Rosemead School of Psychology in Southern California. Really incredible school of psychology, also on Biola's campus, which is a Christian university. And so as I was studying my doctorate, I took master's level theology courses. And so I sat with some of my professors who said, well, no, I don't believe, but they have to sign a statement of faith to be able to teach there. And as a graduate student, you don't have to sign a statement of faith. So I didn't have to do that. But there is this line that a lot of people walk of saying, well, I don't believe, but I am not willing to give up the resources, the community, and the connections that my life is built on. And so I think a lot of people are in a constant state of decision making, and it can be really exhausting finding out where do you fit within, after, or kind of in the mix.
And this is, like you said, I don't judge people for where they're at in this journey because it is so nuanced and so layered.
Yeah.
I just feel a lot of compassion for anyone who relates to anything that we've said so far. It's tough. It's tough. And I was not the first one in my family, I think, to leave the religion, but and I've even been told by my siblings this as well, I was the first to be very vocal about it. And I showed a lot of angerness and bitterness and resentment, and my relationship with my parents struggled for a long time. And I would get into like screaming fights with them because this is also just a personality trait of mine, is like I'm confrontational, and I have never been someone who struggles to say what I think or like say what I feel. And so when I was going through this, I was being very loud about it within the family. But in a way that was like even more isolating for me because I didn't know anybody. One, I didn't know anybody who shared my feelings about it, but two, I didn't know anybody who was on the same journey at the same time. So I, like you said, I just have a lot of compassion for anyone figuring out where they're at with this.
Even with some of the things we've talked about, it's like, wow, this could be like 6 different conversations.
I wanted to go through a list of questions that people sent in. We've touched on a lot of them already just through our conversation, but there are some more specific topics that I'd love to get into. Obviously, everyone's situation is so individual and you don't know a lot of the details for these, but just generally, if you could give your professional opinion or advice on things. Okay. So do therapists judge you when you tell them that you've messed up? And can therapists tell when your patient is the villain in the story?
I love both of those questions.
Me too. I'm so curious to hear the answer.
So maybe just kind of going off of what you said, I'll give myself my own buffer. I am one clinician and many will have different views. So this is a way to look at things. Does your therapist judge you? My mind goes to 2 places. Do humans judge other humans? Yes. So your therapist is a human. They may have reactions to things you say. From my own experience when I sit with my patients, I don't feel a sense of judgment. I will name when I have reactions. So if someone is like really critical of themselves in a moment, I might go like, gosh, I'm really not liking what you just said. Or I may have an experience of going, that just didn't sit right with me. Can we go back to that? I think maybe touching on the humanity, in the same way that when you're walking down the street, you make slight judgments. I don't know if we need to really be afraid of people having judgments of us. What maybe the question is kind of getting at is there a judgment where my therapist doesn't like me and is withholding this meaning of me? And in that case, I would ask your therapist. I would ask them what they think about you, what they think about what you just said. And hopefully your therapist can engage in that with you, because it's really important.
I've never asked my therapist if she likes me.
Mm.
I don't want to know. Oh my God, no, I'm happy with the relationship we have. I don't want to. Imagine she just says no.
That is a huge part of why it's important to explore, because I may say, like, I've had some of my patients ask if I'm married, or how old I am, or if I'm a Christian because I do religious trauma. And I will say, what would it mean to know that about me? And we'll talk about it. And if it feels important, I will give the answer. And if they go, actually, I don't think I want to know because it might change my view of you.
Yeah.
Then we start talking about, so you have judgments of me too, right?
Yeah, definitely.
Yeah.
I think it's a natural fear that people have when approaching therapy to think, does my therapist think I'm a bad person?
Yeah.
Do they think I'm the problem? Or because it comes down to needing to feel safe enough to share in the first place. So I can understand why people are like, are they judging me?
Or does my therapist think I'm so messed up? And I would say to that, no. I would be hard pressed to be shocked by something in a therapy session at this point. And I think it depends on the temperament of the person, like I just really do feel a sense of like big understanding when someone even says something that could feel really horrific. I go, yeah, get that, and so I think there's just a lot of space for you in therapy, that even if I have my own reactions to things, if it feels important, I'll share it. But I may just be able to catalog that as, oh, that's a me thing.
And also, I think, like, do I need my therapist to like me in order for the work that we do together to be important? Because I feel like a common thing people say about therapy is like they want to get an A in therapy. They want to impress their therapist. And I'm like, that's an interesting thing to unpack, because why are you viewing this person as like an authority figure over you that you need validation and approval from?
Yeah.
So I mean, I do think my therapist likes me. We have really good rapport.
Yeah.
So
Yeah.
I think she probably does like me. But I also think maybe if she didn't like me, our sessions are productive and helpful for me. So does it matter?
Yeah, that's a great stance
I
too.
don't know. And then when it comes to like, can you tell when your patient is the villain?
Yeah.
This question makes me laugh.
Yeah.
Because as I said to you before, there is like not a single detail that I won't share in a therapy session. And something that I pride myself on that has taken years to hone is the fact that I will never hold back, even if it's about myself, because I want to get better, because I want to know the answers. Like I want to hear the truth. So if I have to talk about, a situation where I'm at fault in something, I am so careful about trying to explain my role in it as best I can, because I want to know, was I in the wrong? Was I being toxic? And if I was being toxic, how do I get better? So in that sense, I feel like my therapist probably has thought, okay, like Mary's the problem here a couple of times. But I don't necessarily think that's bad either, because as long as you're like willing to hear that, that's the path towards getting better. Like I'll ask my therapist all the time if I'm explaining something that's happened in my life. I'll be like, do you think I'm in the wrong? And sometimes she says no. Sometimes she says yes.
Yeah.
Sometimes she's like, no, like, we've talked about that kind of reaction before, and it seems like maybe you regressed a little bit there. Or she'll say, and I feel glad that we have that kind of dynamic, because I don't feel judged when she says you are in the wrong there, because I'm like, this is your job.
Yeah. And it's something I bring up a lot actually with my patients. I use the word villain sometimes because I'll say, well, I'm the villain in someone's story. I have hurt people in my life, and I would imagine when they see my name, they have a negative reaction to me. So again, I would say there's maybe a tolerance to build. The question kind of feels like it comes from someone who's like, is my ex getting validated, in their therapy session?
Yeah, that's the reaction I had too. The immediate thing I thought of, and I don't know if this is this person's intention, but the immediate thing I thought of is like, there are people who have wronged me in life who are in therapy, and I wonder if their therapist is like validating all the things they did to me. And I feel like maybe that's what the person's asking.
Yeah. And to that, I would say, therapy is first and foremost a space for treating mental health. It's a treatment center. So I'm sitting there recognizing a whole person. I don't
Mhm.
think the person in front of me is all good or all bad. I talk about that a lot with, I don't think when people talk about their parents and they're talking about something really traumatic, I don't immediately go, oh, your parent is a
The
villain.
parent is awful. Yeah.
They're a whole person. And so I would hope that therapists have this context. I have this context when I work with patients that we're talking about whole people.
Mhm.
And I challenge my patients a lot. I don't know if someone who works with me was kind of hearing this, they'd be like, yeah, I'm constantly telling them like, oh, can we check in on that? I don't think that's what's going on.
Yeah.
You
And
know,
that's what you need, though. As a patient, I think that should be what you want out of the relationship, because the goal should be to heal
yeah,
and to get better.
yes. Yeah. So
Yeah.
vil-
Maybe they can tell.
maybe, and maybe they are a villain and they're working through it.
But so here's another side to that question. Can you tell when someone's being an unreliable narrator or someone like plays the victim?
Yeah. Everyone is an unreliable narrator because you only have your own perspective. But in that sense, it is also the only truth you know. And so we are wrestling with having half the story and the only story that's yours. um,
Oh my God, I love the way you worded that. That is fascinating. You're wrestling with only having one half of the story, and it's the only story that's yours.
yes.
Damn.
Yeah, that's the truth. And so I'll constantly kind of bring people back to what is compassionate and what is true.
Mhm.
There is a line that we walk of this is the only lens that you can see the world through. And we will have gaps. How can we tolerate that and still work on managing and living a life that brings you goodness and fulfillment?
Interesting. A good therapist will challenge you as
Mhm.
well, like in a good relationship. And I don't think you should be afraid of that if it happens to you.
Yeah. And maybe to kind
I'm
of,
not going to be mean about it. Like,
no, that is something I will actually, before I start working with someone, I do a consult call and I'll try to kind of feel out, do I think I'd be a good fit for them?
mhm.
And I will say, I balance compassion and challenge. I will call you out, but never in shame. It is with a shared curiosity where we can both go, whoa, what happened there? What was going on there that kind of pulled for that kind of reaction towards this person? And we get
Mhm.
to look at it together. We're not going to shy away from it, but we're also not going to shame it or judge it. That's what happened.
I
Um,
like that. Interesting.
yeah.
Okay. At the end of the day, as well, like, I think one of the most important things you can do in therapy is be honest
Mm,
and give all of the details. I think in therapy, if you're going to therapy because you think the act of going to therapy alone is going to be what gets you results, that's not true.
no.
And if you go to therapy and you hold back all the time, you're not going to get the results you want either, because your therapist needs as much context as possible in order to be able to help you unpack the way you're navigating
Mhm.
the world.
Yeah.
And another thing that you kind of touched on as well is like with this idea of everyone being the villain in everybody else's story, something that I think about a lot with people who have hurt me, because I'm like trying to have a little bit more compassion. I
Mm,
think I've worked on this a lot. And in recent years, like last 2 years or so, it is easier for me to hold space for people who have done me wrong. It wasn't before.
yeah.
But now I feel like I have an easier time recognizing like sometimes people do hurtful things out of an unhealed place, not because they're a bad person,
Mhm.
which is really hard to come to terms with, because when someone does you wrong, what you want to do is just villainize them and demonize them. And it's very hard to hold space for that duality.
And sometimes people are bad people to you. Like that.
Yeah.
There's also there's compassion for you too, of being able to recognize
Hmm.
you you hurt me. So
Hmm.
I don't have to recognize that you are a villain forever and always, but were you a
Hmm.
villain in my story? Yeah, at some point. And so there's a processing of that. Mhm.
This relates to another question that was asked, which is, can you speak on forgiving your parents for generational trauma while wishing they did better? No, I know.
Yeah.
I know. I talk about this in my therapy all the time.
It's really, really tricky. Um, gosh,
No.
my mind goes to, in order to begin that kind of work, my hope would be that you have people around you who can support you and foster a chosen family while you are deconstructing your own.
Mm-hmm.
So my first thought is give yourself a buffer of safety of people who do know you and do care about you and connect with them. And if you don't feel like you have that support group, therapy is one option where you can do that. How to heal, that is going to look really unique for everybody.
Yeah.
I wrestle because I think this idea of forgiveness is rooted in religion, and not all clinicians think forgiveness is the end goal.
Yeah, forgiveness is seen like holiness.
Yeah. And so I think that there's room, like we just talked about, like seeing someone as a whole person.
Mm-hmm.
The dynamic between a parent and child, though, is interesting because it is the parent's responsibility to provide safety and security. It is the parent who's responsible to hold the emotional weight. And so when they fail a child in that sense, that is traumatizing, that is painful. Yeah. There are negative consequences to that. I think it's just so dependent on what your hope is.
Yeah.
Afterwards, are you wanting?
And what happened? What level of trauma are we talking about as well?
Yeah. So, I would say it depends on what do you want to happen. Are you hoping to have a good relationship with your parents where there's repair? Maybe my curiosity would be, do they recognize where they have hurt you? And are they also bending towards you too? Can your parents say, I do recognize where I missed you in that space, and they're also wanting to build repair with you? Or are you kind of against a stone wall where they say, well, I did my best and that's all I can do? Yeah. Then we're kind of dealing maybe with more grief, and it's going to be a very alone process of coming to terms with how do you want to live with your parents in your life. So it's complicated. Yeah.
What helped me was learning how to have compassion for what made my parents what they were, because especially with generational trauma, when your parents are repeating patterns because they didn't break the cycle, I think you're allowed to both feel let down and disappointed and hurt and angry. And you're also allowed, if you want, to think that's sad for them.
Yeah.
Yeah,
absolutely.
And it's hard. My therapist and I talk about duality all the time. It's been one of the most helpful concepts to implement into my daily life, because once I realized, because Christianity is so black and white, there's only one truth in Christianity. So I had to learn the idea that there could be multiple truths.
Yes.
Once I learned two things can be true at once, I can feel let down and disappointed and hurt and recognize that it's going to take me years to get over this, if I get over it at all, and all these things. And I can recognize they were doing the best they could from what they knew at the time based on their own trauma and their own experiences. And
you can add so many ands afterwards, right? Is that
and it's not easy, and it's complicated, and it's very messy, and there's not one clear-cut answer.
Yeah. And you do not owe your parents. That's a big piece too that gets lost. You do not owe them forgiveness or repair. You can choose it, but I think
it's okay not to forgive.
Yeah, it's okay not to forgive.
That's hard. That's a hard concept to come to terms with.
And you may still choose, I could say I don't forgive and I still want to have relationship. And I could say I don't forgive and I'm going to take steps to distance myself. The intention could be the same with really different outcomes. I think that's, again, kind of leaning back into what was the pain? What is important? What is the current relationship dynamic? Is it still fraught with distress? And what is the hoped for outcome? And then are we willing to grieve that we might not get it? If the hoped for outcome is that my mom apologizes to me, we may have to say, your mom may never apologize to you.
And I'm going to share an anecdote. And I don't want this to come across like I'm telling anybody to just stick it out in a situation that's harmful to them because maybe it'll get better. Because that's not what I'm trying to say. But just for me in my own process, I received an apology from my parents for keeping me in religion last year.
Wow.
Which was monumental for me. And it took years
Yeah.
to get it. And it took years of fighting and long periods of not talking to them, and a lot of work on my own end and a lot of work on their end, like years.
Mm-hmm.
But I got an apology last year.
Wow.
It messed me up emotionally for weeks.
Yeah.
I was talking about that in therapy for a long time because first I just couldn't believe it. And then I was like, in a weird way, I felt like I didn't even need it anymore.
Do I even want this?
And then I was like, I don't even want this, like, because you can't change it.
Yeah.
But then I was like, but oh my God, I'm so happy that they've gotten to a place where they feel able to give it. And like, it was so complicated. And again, I'm not telling anybody who's in a situation that's harmful to them that you need to stick it out.
Mm-hmm. Not
at all. But maybe just a point of hope for someone who wants it. Mm. It took me years, but I did get one.
Yeah.
I don't know.
Incredible.
Honestly, one of the best moments ever. We all cried. We cried a lot.
Yeah, beautiful.
We cried so much. Mm. And then I hung up the phone and I cried for a lot longer because I was like trying to keep it together in the phone call.
Yeah. Wow.
I don't even think that they know, like, to this day, what exactly that meant to me. Mm. Maybe they never will. I told all my siblings. I was like, guys, you'll never guess.
Wow. What an incredible experience to have.
It was. And yet at the same time, it's interesting that it brought up even negative emotions in me, because you'd think like that would be perfect. What a sigh of relief. That's the closure I needed. In some ways it's not, because it's like, well, great that you see that now. Why couldn't you have seen that 20 years ago?
Yeah.
It saved me all this trouble.
Yeah. Yeah. I mean, it's not going to be black and white. It's going to be really gray, and there's room to change your mind.
Here's an interesting one. What mental health trending topic do you wish you could correct the perception of? Mm-hmm. I have thoughts. I asked my therapist this question yesterday, and we actually have the exact same answer. So I'm interested to hear what your answer is.
Okay. I also reached out to some of my best friends who are psychologists, because I was like, hey, we have an opportunity for some.
You have the floor. Tell us.
So we have two shared ones. And I'm going to pull a little bit of clout. One of my best friends is a pediatric neuropsychologist. So her entire profession, she is incredible, is assessing and treating ADHD, autism, the autism spectrum, learning disorders. What I wish I could change the perception of is seeking out pathologizing in order to have validation.
That's what we said. That is exactly what we said.
Yes. Oh, this is my soapbox. Thank you, Mary, for giving it to me.
No, please. This is my favorite topic. You have the floor. Tell us all about it. Yeah. That's exactly what we said.
Yeah, I think it's a shared frustration for a lot of reasons. One is, I think there was a swing in attempt to destigmatize therapy that then made it this global need. And it brought actually a lot of issues to the forefront. If you are seeing a therapist and you're using your insurance, they have to give you a diagnosis. Not everyone who's going into therapy has a diagnosable mental health disorder. So it started to overgeneralize the prevalence of some of these disorders where maybe you actually don't meet criteria for that. And also in people's, I feel like heated talking about this.
No, I know. My heart has started beating faster. Also, I'm not surprised to hear that the American healthcare system is partially to blame for this. Just one more grievance to tack up.
Yeah, I'll throw her under the bus. There is, I think, also in the attempt for people to share their own experiences, again, in order to get validation from, I think, other people, pathologizing it. I mean, the amount of videos that I have to quickly scroll by so my feed doesn't give me anymore of, I rewatch this show all the time, so that means I have ADHD. And if you do this, you have ADHD. And if you do this, then you're on the autism spectrum. And it's just fraught with misinformation. And then people double down. And then they threaten clinicians who do not give them the diagnosis they want, saying that you are invalidating their experience. So this is what's tough. ADHD is a developmental disorder, which means it is something that we see early in childhood. It is impacted by the structure of your brain. And we would have to see evidence of it in childhood for it to get a diagnosis and then resources. Mm-hmm. A lot of people were missed in the system. That is true.
Especially women.
Yeah, especially women, but also the surge right now of attributing everything to ADHD really bypasses what is clinical. The need to be diagnosed is because what people are often talking about is executive dysfunction. So I have difficulty paying attention. I have a hard time concentrating. I'm easily fatigued. Those are all symptoms of generalized anxiety disorder, major depressive
Mhm.
disorder, post-traumatic stress disorder, personality disorders, bipolar disorder, OCD. It shows up in every category.
Like 2 weeks ago or 3 weeks ago or something in a podcast episode, I said that I felt like I was struggling with executive dysfunction, and I was surprised because I'd only ever heard it within the context of ADHD symptoms. And I was like, is
Mhm.
this a bipolar thing too? I don't know. I just feel like I am going through it.
Yeah. And there's also contextual factors. We have more access to any information we want than we ever have in human history, and our brain hasn't changed. The structure of our brain hasn't evolved or grown or looked different. We are just fraught in a system with so much information and chaos. We also have huge humanitarian crises happening, excessive trauma, excessive suffering that we are chronically exposed to and expected to engage in capitalism in the midst of it.
Mm-hmm.
So, yeah, it does not surprise me that you cannot concentrate on your PowerPoint for work when
Mm-hmm.
this is on the news, this is happening in your family, this is your family history. It's just not
Right.
one track. So I would say what I wish people could distinguish, what I tell patients is treat social media like a stranger at a party. If you hear someone say something who's a stranger at a party and they say, oh, I do this thing and that means I have ADHD, naturally you might actually just have more questions and you might go, oh,
Mhm.
interesting.
How
But
do you know that?
yeah,
What
but
are your qualifications?
yeah, exactly. We would be probably much more curious, but for some reason when we're scrolling and we're vulnerable and it's these pocket moments, we take it as
Mhm.
advice and solutions
Yeah,
when it's just not the case. So you probably do have executive functioning difficulties. I do not deny that, but is it ADHD? That's going
or
to
is it
take,
something else?
yeah, you sitting with a professional and talking about it. And I would ask, what would it change for you to have
If it was.
if it was? Because at this point, if you are an adult and you are working and you have relationships and you have been able to hold down a job, you're not going to get resources. You will be given the exact same advice by a clinician, by a doctor, that you would for anxiety or depression, which is going to be management and lifestyle changes and coping skills.
Well, do you think people are seeking medication, or do you think they're just seeking the validation of a label so that they can say, well, this isn't me. It's because I have this condition, which I really have a lot of empathy for because it helps me to know in a moment where I'm really not doing well. It does help me to say to myself, I have a condition. This isn't me.
Yeah.
It is me, but it isn't. You know what I mean?
Yeah. That is something I would talk with people about. What is your hope? Really, when people come to me and they're telling me that they have ADHD, they're rarely asking about medication. It's really to
Interesting. Okay.
what I've noticed is when I start to explore it with folks, I say, what would be different about this being trauma? And they say, well, then I would have to take accountability for that. I'd have to process it. And people somehow equate other disorders with like a hall pass. And so I think that's
Mm,
also a huge disservice to people who actually do have ADHD and are trying to function in this world that does not fit them. It is a
mhm.
huge disservice to say they get this hall pass in life when it actually makes life so much harder.
I think that all the time because
Yeah.
when I don't see this as much with bipolar because I think the word bipolar is scary to people.
Mm,
Like I think bipolar disorder sounds scary to people.
mm,
But sometimes when I see that type of content about OCD,
mhm.
my thing that I keep thinking about is like, you don't want this.
Right.
Like, you really don't want this.
Yeah.
You don't, I am not ashamed of the conditions that I have. I'm not ashamed of my diagnoses. I don't hide them. I'm not embarrassed about them. But also, I don't want them.
Mhm.
I don't want them. And sometimes that feels taboo to say online right now.
Yes, because
It
there's no
feels
identity.
yeah, it feels like someone's going to get mad at me, or someone's going to accuse me of perpetuating negative stereotypes or me of perpetuating bias. If I'm honest about the fact that I would absolutely rather be neurotypical. Are you kidding me? Like, I love it when other people are able to find ways to feel not comfort, but to feel not embarrassed of who they are, even if that means their mental health. But something I see a lot is the phrase like being neurodivergent is my superpower or something. And if that helps other people, then I am genuinely all for it. I'm all for it. Like no shame or judgment whatsoever to anyone who feels that and who gets peace from that. I don't.
Yeah.
I will give it up in a second.
Yeah. And again, it's that kind of quest for very pathological language to seek out validation. You know, I think we miss the humanity of a person and also
Mm-hmm.
agency, like self-agency to make different choices.
Mm-hmm.
I've worked with people with personality disorders, and that can be a scary thing to own and to name. And we talk a lot about that. And then we say, and you still have agency. So the reaction
Mm-hmm.
come up no matter what. The perception is going to come up no matter what. How do you want to show up with them? That's where you
Mm-hmm.
have agency. And I wish that was the path instead of just stopping at pathology and stopping
Mm-hmm.
at label seeking, that we could shift into what do we do
Yeah.
with it? What do we want to live?
Exactly.
Yeah.
Having the label didn't fix me at all. It
Right.
was good. And I always say getting diagnosed was a really helpful part of my journey
Yeah.
because up until that point I didn't know. Getting diagnosed led me towards medication. It led me towards a treatment plan that actually works for me. It's made my quality of life better.
Yeah.
So I know I just said that I would give it up in a second, and I would. Like, I would rather be happy. I would rather like not have every single day of my life colored by like mental health issues.
Yeah.
But at the same time, I'm so thankful that I got a diagnosis because it led me towards getting better.
Yeah.
But just having the label doesn't. Like just being told you're bipolar, I'm bipolar type 2 rapid cycling, that means nothing.
Right.
All that means is now I have a way of getting the help that I need and the treatment that I need. But I
Yeah.
feel like another reason why people maybe seek the label is because of the sense of community that comes from it, because then you're able to connect to online communities or
Yes.
people you know in real life who share your experiences, and then you feel less isolated and you feel like, I think something that people with mental health issues struggle with in the day-to-day world is you just feel so different from everyone around you. You feel like an outsider. You feel like no one knows what's going through my head right now. No one sees how deeply I'm struggling, how much pain I'm in.
Mhm.
And being connected to a community of people who understand helps. It
Yes.
helps. And I like completely understand and have empathy for the fact that people want that community. They want that connection.
Yeah. And maybe again, those might serve you in those moments. I would say it's kind of like what you referenced earlier, like a trauma bond. Sometimes you need that to survive, but the hope is that you connect with people broadly, not just over suffering.
Mm-hmm.
And so, yes, you may be seeking out community to align with like the struggles that you experience in life.
Mm-hmm.
But hopefully there's also, even in those communities, a broadening of a whole person who is not just, you know, bipolar, not just having OCD, not just living life with borderline personality disorder, but a whole
Yes.
person. So
Yeah.
even then, I would say maybe that might be step one, but it is not the final step that is being advertised right now.
Yeah.
Yeah.
Like something that I try to do with my content is share the fact that I have bipolar and I have OCD because it's true and it's real, but then also not make it my whole thing online, because to me, the most helpful thing when I see someone else who struggles with mental health conditions is seeing them lead a happy, fulfilling, otherwise pleasant life, and where they're achieving things and they're in a relationship or they have a family or they're, I don't know, they're in their dream job or something like that. And just seeing like, this is part of what makes you a person. It
Yeah.
colors your experiences, but you can totally work, like you can work on it, and it doesn't have to mean your life sucks and is miserable.
Yeah. I think what you do is really groundbreaking because it actually adds to the nuance instead of adding to the echo chamber. You know, you are adding to the nuance of saying, I could really enjoy life with my partner, or this trip I go on, or these hobbies I build. And another day I could be so fraught where I can't even leave my house. You know,
Mm-hmm.
we don't really have a lot of nuance around this messaging. And then we get confused when people show good parts of their life. And that is sad because we're acting like people who are walking through the world with mental health don't experience joy, or it's only one or
Yes.
the other. It's this black and
Yes.
white. And
I
so,
don't get this. Yeah, I'm sorry.
oh no, I think there is so much need for nuance around what mental health actually looks like, and that goodness doesn't disqualify suffering, and suffering doesn't disqualify goodness.
Well, thank you for saying that. I appreciate that because it's definitely not the most fun thing to talk about
No.
online because it is so vulnerable. It's always hard to be vulnerable. I don't really get this anymore, but I remember years ago when I first started posting and talking about this, I would get comments all the time saying that I was faking it, or I diagnosed myself or that I was lying about it or exaggerating it and things, because I would also show good days and happy days. And there is this perception that if, oh, I'm bipolar, that must mean every single day is hell.
Yeah.
And it isn't. And I remember reading those things and just feeling so confused because I'd be like, I can post a video saying I was diagnosed by a clinical psychologist who got a backup opinion.
Yeah.
And it took a long time, and we explored a bunch of different avenues and different things before settling on this diagnosis. And yet someone on the internet is saying, well, I saw you happy 2 videos ago, so you are lying.
Yeah.
It was a bizarre thing. I mean, I'm used to it now. It doesn't bother me now. But back then it was bizarre for me to get that type of comment.
I can't even imagine that. Because even preparing for today, I was having to tell myself, no matter what I say, someone's going to respond with what I didn't say. And
Exactly.
That's maybe part of this conversation too, is it's really hard to hold that if someone is talking about one thing and they're not talking about the 10 other things involved,
Yes.
that they're wrong.
The what if, the what about.
Yes. Yeah. It's so tricky.
Yeah. I'm my heart is beating so fast right now because I'm feeling anxious thinking someone is going to get mad at me for saying I don't want to be bipolar.
Yeah.
I'm still thinking about, and I probably said that 15 minutes ago, and I'm still thinking about the fact that I just said online that I don't want to be mentally ill, and I feel like someone is going to get mad at me for that.
Yeah. Well,
oh well.
We'll probably get really mad at me for talking about religious drama, so I think we'll be.
It is what it is.
The other one that I kind of also polled other therapists about, because it's something that frustrates me and I kind of wanted to check in on, is the hype word of boundaries. Boundaries are things you do for you. They are not things that other people do on your behalf. And that seems to be this really quick pipeline to then cutting off relationships or cutting out the toxic people who aren't good for me in my life. And I think there is a lot of confusion that boundaries are what you do to show up for yourself.
Mm-hmm.
No one can cross your boundaries without your permission. And I think that gets confused a lot with, well, if I say I have a boundary, then they don't respect it. They cross it. They did something wrong. It's no, they didn't come up with the boundary. They haven't done a wrongness. You might not like what they did, but there is a need to kind of distinguish. You are the one who sets your boundaries. You are the one who executes them. You are the one that follows through on them. Okay. And then you are the one that takes appropriate action when they are not met.
So can you give an example of something that is a boundary versus something that is not?
Yeah.
Where does this go wrong?
I think this shows up a lot in conflict, in relationships, or clashing values. So for example, let's say there's yelling in a relationship. So I would say a boundary for me is I'm not going to sit and be yelled at. There's just no communication that can happen if someone is yelling at me. And so if someone raises their voice with me, I might say, a boundary would be saying, if you raise your voice at me again, or if you yell at me again, I'm going to have to leave the conversation and I'll come back when we're able to talk, because I'm not going to tolerate being yelled at.
Okay.
And then someone yells at me again, and then I say, okay, I'm leaving.
Okay. Versus saying, my boundary is don't yell at me.
Yeah. And
If
then
you
they
yell
yell.
at me, you crossed a boundary.
Yes. And then if they yell at me and I say, you're crossing my boundary, you're doing something wrong, you shouldn't be yelling at me, I'm making someone else responsible for what I have decided I need to protect myself.
Okay.
So that shift, I think, is really key because it actually protects you more. You know, if you recognize that you have agency over your boundaries, you have a lot more freedom to move through relationships than if you're constantly looking for who's going to hurt you, you know?
So basically what you're saying is a boundary is not saying you can't do this thing. It's saying this is how I will act for myself if the thing happens.
Yes, exactly.
Gotcha.
If we can get away from having to always label somebody and then lock them in that, we actually may be able to have more repair and more connection. If I can back away for a moment from locking you in on this one thing, I actually might offer more freedom for myself and maybe in turn for you for new experiences.
Yeah, and it's hard. All of this is hard. Everything we've talked about today has been hard because I feel like it is almost always the more difficult choice to choose growth and healing. It's always a lot easier to stay stuck. And it sucks.
Yeah.
It sucks.
Yeah.
Me and my best friend, my best friend has been in therapy for a long time too. We talk all the time about how, like, why does it feel like the people who need therapy but choose not to go to therapy seem to be just having a better time in life than we are?
Yeah.
I don't know.
Well,
But it's the right choice as well. Like it's the more emotionally difficult choice. But I think like the goal should always be growth. It should always be evolving, giving yourself compassion for what you've gone through and allowing yourself to feel where you're at right now, but then to also recognize it's my responsibility to work on myself. And I've said this in episodes before too. When it comes to being mentally ill in a relationship, specifically with my husband, I think it's my responsibility to work on myself so that I can bring the healthiest version of myself to the marriage. Because otherwise, it's almost like I'm knowingly doing a disservice to this person that I love. And it's tricky because I also have to, like you said, have compassion for the fact that these things are hard for me. Like XYZ is really hard for me.
Wow.
But also at the same time, if I know they're hard for me and I'm privileged enough to have access to help, which is another part of the conversation. A lot of people don't have that privilege, but I have the privilege of access and I'm aware of these things about me. So I feel like it's my responsibility to try to grow.
Yeah. Even as you say that, what comes up for you? Like the idea of responsibility.
Part of me feels resentful towards the diagnosis. Something that comes up for me is feeling angry that it's even my job to do that because I didn't ask to be mentally ill.
Yeah.
So that's a big one that comes up.
100%.
I also have often struggled with a sense of guilt that my partner has to deal with me. And deal with me is my words. They're not his words. That's not how he feels about it because we've had so many open conversations about life together as a couple when one of us is bipolar and has OCD and one of us isn't. He may not view that as a burden, but I view myself as a burden. So I have resentment and guilt.
Yeah.
Those are the things that come up for me.
Yeah, so tricky. Even as you're naming that, I was thinking with all of our awareness, one of the things that can really cloud us in shame is like still the internalized stigma, the belief that people who struggle are inherently less deserving. And it can be a really, really hard thing to offer compassion to.
Yeah. An ongoing lesson being learned.
Yeah, same.
Yeah. I think like self-esteem and self-worth is one of the trending topics like in my therapy sessions across the board and maybe always will be because I've done a lot of repair and there's a lot of repair still to do, but also like the concept of self-worth is the foundation of so many healthy behaviors and the absence of it is the foundation of like toxic or unhealed behaviors. it's like crazy how much of the way we act towards other people relates back to how we feel about ourselves.
Yes. Yeah.
I know.
I'm sitting here actually throughout this whole conversation. It's been really lovely because I think you have a great way of maybe what people call like the elevator pitch, but you have a great way of like being concise about something that's really profound. And I've just found myself kind of sitting going, yeah, that's exactly what I would say. Yeah, you have great language for a lot of this.
I don't think I can take any credit for that. I think I've been in therapy for so long that like I've been able to make it all make more sense in my head, you know?
Yes, you have.
I'm probably just regurgitating what I've been told over the last decade.
Well,
Thank you.
Yeah, you've done the labor. Take some of the credit.
I guess. Well, I cannot believe that we've been chatting for almost 2 hours. This has been really enjoyable for me.
Yeah.
Like I told you before we started recording, I really view therapy as one of the best possible things that I could do in my life. And like going back to therapy, especially this most recent time with a trauma-informed therapist, has been the best decision for me, especially as I get older. I'm 25, turning 26 this summer. And I feel like I have felt a shift in myself, realizing, okay, like early development is over. That first stage of getting out, you know, on my own and learning how to navigate the world as an adult, that's over too. And now I feel like I'm getting into it. Like I'm settling into this idea, like I'm an adult and I have responsibilities and things. And a big part of navigating this new phase of life for me is realizing there are things I need to work through. I guess I've always kind of known that, but especially this age.
Yeah.
Like, there are things I need to do. And I wouldn't be able to do that without therapy. And I can't imagine how emotionally difficult sometimes this job must be. And I just think everyone who chooses to take it on is doing such a service, service to the world. So thank you for your work. Thank you for talking to me and like for speaking to the podcast. I think this is going to be like such a great episode, but also thank you just for the work that you do and for the trail of help that you're leaving behind as you go through the world.
Thank you so much. It's such an honor to be here and to have met you and to kind of share it in this really vulnerable space. But I always walk away from things like this feeling really hopeful. So it was so nice to be able to connect with you on it.
All right, you guys, that's what we have for you today. I can't believe we talked for 2 hours and yet we just didn't want to stop talking. We had so much fun recording and I learned a lot in this episode. I'm very proud of it and I'm excited to share it with you. I hope it helped somebody today. Let me know what you thought about the episode. I would love to have Dr. Reep back on to talk even more in depth about these issues. So let me know what you thought and if we should have her back on. I think we definitely do. Thank you so much for listening to Prologues and spending your Monday morning with me. This was definitely the longest episode yet. So thank you to everyone who even made it to this point. And let me know if there are other guests you would like to have on Prologues this year. I don't do guests very often. I do a lot of solo episodes, but I'd love to have more guests who are experts in their field come on the podcast this year. I feel like we're all so curious about different topics related to health, mental health, wellness, all the things. So let me know who else we should have on the podcast. Thank you again for listening, and I will talk to you very soon.